Hello, friends, and welcome back to the Rabbit Hole. I'm your host, Danny, and today we have the pleasure of having Dr. Aaron Hartman on the podcast. He is a triple board certified physician who worked in the Air Force as just a regular doctor, but the diagnosis that his daughter had led to surgeries that him and his wife did not want to consent to, which led him down the path of functional medicine. Functional medicine, unlike the traditional healthcare system, is patient-centered, science-based approach that identifies and treats the root cause of disease rather than just the symptoms. They really look at like the whole person instead of just take this medication and get on your way. We cover so many topics in this episode. If you have a question, I might have asked Dr. Aaron for the answer. Hi, Dr. Aaron. Thank you so much for joining us on the rabbit hole. I am really excited to hear your story because I feel like so many people's stories start out the way that your story does, with like a sick family member, then the medical industry, like wanting to just like throw pharmaceuticals at it or like surgery. And most people kind of end up at the end of the day with like an, I don't know what's wrong with you, like take more medicine. And so, will you tell us your story, your daughter's story?
My story, it's a little different, a little same to what you're talking about. I was in the military, traditional doctor, academic, doing all the usual things. And what got me off the beaten path, so to speak, down the rabbit hole, is literally down by this point in time about 50 bazillion rabbit holes.
Yes.
It was we brought our future daughter into our home, and my wife is a occupational therapist that works with kids with special needs,
Hmm.
very complicated kids, and we brought her in our home, and she has a diagnosis of cerebral palsy. But how she got that was her birth mother did crystal meth the entire pregnancy.
Oh, wow.
She had a stroke before she was born, and she was born functionally blind, so pretty poor prognosis.
Yeah.
And the GI doctor is like, hey, by the way, she's also small. It's called failure to thrive. So let's put a feeding tube in her belly, put a plastic tube in there, and just pour sugar water called formula into her belly, and that will fix the problem. She'll gain some weight, problem solved, right?
Right.
But we had higher goals. My wife was like, everything's gonna be okay. She's gonna be fine. Um, and so to that, my response was, well, why would I put a feeding tube in her? Because part of learning how to talk is chewing and swallowing. Like literally chewing and swallowing is how kids learn to talk. You develop
Oh,
motor skills.
I did not know that.
Yeah, it's like, well, that's one of the reasons why it's important to feed kids the right food, not just suck on bottles and stuff. It affects oral motor development. And one of the ways you learn how to walk is you first start crawling, right? And if you have a
Hmm.
plastic tube coming out of your belly, well, then that's going to affect motor neuron development. So we said no. And the result was that the GI doctor reported us to Child Protective Services for medical neglect because we refused to put that tube in there. And it was kind of weird because they came out and investigated us. I was a captain in the military, medical doctor. My wife's a occupational therapist. We were in the
What branch were you
system.
in?
I was in the Air Force.
Okay, I was in the Navy.
Oh, cool. Yeah, this was that MacDill Air Force Base, actually. It's SYNCOM, SOCOM.
Hmm.
I ran that clinic for a bit. But and so got investigated and everything worked out okay. But it was like the system really didn't like it when you said no, when you gave pushback.
Hmm.
I just started making my wheels turn. Like, that's kind of weird. Like, I got investigated. I'm not a criminal, And
Yeah.
6 months later, though, this was like when the weight of the world came on my shoulders and I had to make a change. Was my wife actually, in her research, found a growth chart for kids with cerebral palsy, and my daughter was in the middle. She was normal.
Oh.
And so the expert didn't know. The expert didn't know that she was fine, that she was in the middle. They had the wrong information, the wrong data, and they recommended the wrong procedure, which was a feeding tube.
Yeah.
And if we went through with that procedure, one procedure leads to another, and these kind of kids. And put things in perspective, Anna's turning 20 now. She's getting ready. She's gonna be my first child that leaves the home actually in April, and she's had zero surgical procedures to date.
Wow.
Typical kid her age has had 13. So
That's
13
wild.
surgeries, yeah, versus zero. And so when I realized that she was normal for her growth, like the expert didn't know. And all of a sudden, like, what else do they not know? What else are they getting wrong? And who's going to figure that out? And so that
Hmm.
got me getting up. At that point in time, had to be at base at, my job started 7 in the morning. So I was getting up at 4 to read, to research, to learn stuff. And that supercharged my learning. Probably in the next 3 years, I'll learn what someone typically learns in 7 or 8 because I was just reading, reading, reading. But that rabbit hole that I went down it's like Wizard of Oz, right? The
Yeah,
world's in, the black and white world is actually color. You learn about functional neurology and gene-based nutritional therapy and a whole host of other stuff. And it opened my eyes to like what options there were. But ultimately, that changed my entire practice of medicine and what I do now. And now I see people with complicated cases that have been the average person I see right now has been to 5 to 7 different doctors before they come to me. And I connect the dots of all the things they've overlooked to figure out this was your mold, this was your Lyme, this was your POTS, this is your hypermobility, whatever the thing is that these other places just overlooked. And that's unfortunately happens pretty commonly in our current healthcare situation.
right. That's and yeah, you're right. Unfortunately, that's what's happening, and I feel like a lot of people don't look at it the way you do is like we don't have to do this. And a lot of people are scared that they will be reported. They're like, I can't say no because firstly, they're the expert. They're supposed to know everything. And secondly, like if I do say no, I'll be reported because I'm trying to advocate for my child. Like there's got to be a different option.
And maybe my wife, and that thing in the special needs world, that happens all the time. My wife was dealing with a lot of these complicated cases. They were going to Children's Boston, Mass General, and there's situations where they would go up there with these rare diagnoses. A well-meaning physician would say, "This is weird. You're a Munchausen's by proxy," which means
Right.
mom's making it up. The mom's faking it and hurting the kid to get attention.
Yeah.
And they lose a kid for a month or two or three. So I knew that happened. And so in this case, I'm like, yeah, okay, this is not what's going on, but it does happen. It's not unheard of. And it's really bad because it happens typically to people with rare diagnoses, unheard of diagnoses that the system doesn't recognize. And so obviously the mom's crazy, the parents are crazy, a lot of medical gaslighting happens,
Hmm.
and ultimately the kids are hurt. And so, yeah, that's one of the many things I've kind of learned in my medical journey.
Well, we hear that a lot, and I wasn't going to ask this question this early, but I'm
Mm.
going to jump in since we're here. We hear that a lot when it comes to vaccines, and I know, like, personally, I have had a lot of looks and like I mean they don't some of them say it outright, but most people are like, "Oh, you're not gonna vaccinate your children," or like my son had strep throat, we needed to go get antibiotics, so they're like, "Oh, like he's not vaccinated?" Like I'm some weird person, but I'm like I don't like will you talk about vaccines?
Will I or
Yeah,
what?
will you? Because I know
I
like I have opinions about it, and so I want to
yeah.
hear from a medical professional.
Yeah. I'd be happy. I'd love to talk to vaccines about you. Put things in perspective. I'm assistant clinical professor at the local medical school. I ran a research company for 15 years, published in Lancet, some very science-based. So let's have a conversation.
Yes, please. Because I feel like there's a lot of misinformation. There's people that believe like vaccines are totally bad. There's other people that believe vaccines are totally good. And there's a lot of people in the middle. And so, and
Yeah.
especially with COVID, like people started
Yeah.
actually asking questions about them.
Yeah. So if you just take a 10,000 foot view,
Hmm.
when I was doing my pediatric intensive care unit um, time during my internship year, 2000 at the Medical College of Virginia, super busy, one of the top universities on the East Coast. So on the East Coast, it's a really busy place. And so I did not see pediatric meningitis the entire time I was there. And Dr. Mallory, who was the head, she's like, yeah, we used to see 10 to 20 cases a month. We don't see it anymore because of the Hib and Prevnar vaccine.
Yeah.
Most meningitis used to be Hib and Prevnar. Whooping cough, pertussis used to kill kids. Don't see that anymore.
Hmm.
So those are vaccines, and these things are still in the environment, right? So there's some things we still need to do. Then there's the whole thing with rotavirus vaccine, which gave kids intussusception, and it didn't really pan out. The whole hepatitis B thing always was fascinating because you get it from sex with prostitutes and IV drugs.
Hmm.
So, like, why do you need it at birth? And actually, it was interesting because we were one of the first centers to do some of the research at MCV with this. The kids would actually get the vaccine when they're born and get a fever,
Yeah.
101, 102 degree fever, which newborns are not supposed to get. And so the kid would then get blood cultures done, spinal tap done, stay in the
Oh my
hospital for
gosh.
3 to 4 weeks. Yeah, because fever in an infant is assumed to be horrible because they don't get fevers, right? It was
Yeah.
just the vaccine. So then what happened is that we started doing, well, actually, we'll give it to the kid right before they go home. Because it's that way they get the fever at home and the mom won't even know, right? Well, I know. I'm just
It's
I am
awful.
not
I
actually
know.
I'm actually not making this up. This is the way it was. But why were we doing that at the Medical College of Virginia? Because many of the mothers there had drug use issues. They weren't going to come back to the hospital. Their kids wouldn't be seeing the system for 8, 9 years. So let's play it safe. You know, that's not where most kids are born and where most moms are at. So why are we taking the exception and generalizing that to the population? So I think, when you think about vaccines and the HPV vaccine, another great example
Yeah.
of a vaccine, there's a great book, The Immortal Life of Henrietta Lacks. It's on my reading list on my website. Great book about, if you've ever heard of her name, the HeLa gene. She died of cervical cancer. In the 1950s, the most common cause of death in women in their 40s was cervical cancer, right?
Yeah.
That went away. Why did cervical cancer go away? Because of the HPV vaccine or because of the PAP? It was a PAP smear is what eradicated that. And so all of a sudden, like, there's maybe 2,000 deaths of cervical cancer, all horrible in the United States, every year. I've never had a patient of mine die from cervical cancer. Why? Because the pap smear. So all of a sudden, is the HPV vaccine like mission critical for young women,
Right.
especially since it's known to cause or be related with syncope and POTS. And there's actually a gene test you can do that can test the susceptibility for people, young women, to getting this. Do the pediatricians get this? If they're going to mandate it, do they get it? And the answer is no. So, is the HPV vaccine mission critical? Well, we have pap smears.
Hmm.
And are you checking these young ladies and guys for this HLA-DRDQ gene, that thing that actually makes them more likely to get the side effect? The answer is no. Then why are you going to mandate that? So there are ones we should mandate. Hepatitis B vaccine, maybe you get it when you go to college. Maybe you get it. It used to be you get it if you're going to going to healthcare. You're going to work in the jail. You're going to work a place where you might get needle sticks, right?
Right.
But to give it to the entire population is probably a little overkill, especially since liver cancer and hepatitis in our country that this kind are not that big of a deal. Big deal in Asia, big deal in sub-Saharan Africa, not a big deal in Virginia.
What about the MMR vaccine? Because I know that one has a lot of controversy around it.
The MMR, I mean, measles, mumps, rubella they are a big deal. If you're pregnant and you get measles or mumps, you can have massive birth defects in your child. Um, so so should the child get that vaccine, it's still in the environment. Measles, is I think part of the conversation is we do these bazillions of vaccines and we pick one out. Like kids probably would not have an issue with MMR vaccine if they didn't get 30 other vaccines.
Right.
You know, um, the chickenpox vaccine is another live virus. I got chickenpox. Like maybe you do that when you're 4 to 6. Do you need a chickenpox vaccine when you're 12 months old or when you're 18 months old? And chickenpox is one of those weird things, kind of sort of like polio.
Hmm.
If you get it younger, it's less severe than when you get it older. So why are we putting it super young? It's just kind of the way we're doing it. So I feel like there should be a conversation about this. And oh, by the way, if your kids' vitamin D levels are okay, if their nutrient levels are good, if they're getting a clean diet, what are the risks for some of these things as well? It's going to be less. And so we kind of forget that a lot of these illnesses, these plagues of the past, came up in situations when nutrient deficiencies were rampant, when people were typically malnourished. Um, and so there's great examples actually. In my I don't know if I mentioned this in my book. I may or may not. Actually, I do. Caisson disease. There was a great example. Here we go. Things popping in my head, right?
No, I
Of
get
a,
it.
a of a virally induced heart issue in China, cardiomyopathy induced by a um, a virus. And so the United States was in the process of working on a vaccine with China. Come to find out, there was a mineral deficiency in this whole region that was affecting tens of millions of people.
Wow.
They gave them the deficient nutrient, and all of a sudden, the virally induced heart failure went away.
Hmm.
So how often is that happening? The answer is it's more often than we like to think. So there are some vaccines we should definitely look at getting. Hib, Prevnar. There's some ones we should definitely think about putting off. I'm sorry, hepatitis B. And there's some ones that are kind of like polio is a bad thing. Is there any endemic polio in the United States? No. It is active right now in Pakistan, Afghanistan. So if you're in an area where there's a lot of refugees from that part of the world, you should get it. But my patients in rural Virginia who want to put it off for a year or two, why not?
I was gonna ask that. Like, so if people are going to, they still want to vaccinate, but they're not necessarily want to vaccinate and get 6 shots at their 2 month
Yes.
old appointment, is it okay to put off these vaccines like years? How many years?
So it depends on which one you're talking about. Some of them you can put off till high school for
Okay.
sexual activity, like the hepatitis B vaccine. Some of them you put off a couple of years. The chicken pox one, like, oh, I had chicken pox. Everybody used to get chicken pox back in
We
the
used to
day.
have
Maybe you put
chickenpox
that.
parties.
My wife actually, when she was a kid, got chicken pox, and she was sent to all the houses in her neighborhood to give all the kids chicken pox, right?
Yeah.
So literally, maybe you do that later on. The reality, unfortunately, because most people have had the chickenpox vaccine, it's super rare now to get chickenpox.
Yeah.
So you're probably going to want to get it. For my son, for example, we were going to Disney World and he was 8. And it's kind of like, there's gonna be a lot of people around the world Disney. I don't want to deal with an 8-year-old kid with a fever and feeling cruddy. Let's just give him the vaccine.
Right.
Um, but does he need it when he's like 12 months old? Maybe not.
I think everybody has a lot of these questions because it's just our world right now, especially with COVID. But um you talked a little bit about nutrition, and I wanted to get into like how nutrition is affecting health in general and why it's completely overlooked by like the medical industrial complex.
I mean, 80% of heart disease and 70% of most cancers can be prevented by diet and lifestyle alone.
Wow.
Just
Can you say that again? Wait, say that again for
80,
emphasis.
80, it's in the book. 80% of heart disease and 70% of most cancers can be prevented by diet and lifestyle alone. Now, we can spend hours talking what this means, but the basic gist is healthy diet, real food, healthy lifestyle eliminates 80% of the number one killer and 70% of the number two killer.
Wow.
So, how can nutrition, lifestyle stuff not be a part of our healthcare system?
Yeah.
How can it not be reimbursed? How I don't know. It's just the way the system is. I mean, I do know our system is an acute care system. If you were to have, if you were to have an acute stroke, I would want to be here in the United States in Richmond, Virginia, within 2 hours, I'll be getting a clot buster at Johnson Wales Hospital, my local community hospital right here, good old fashioned St. Francis Medical Center. They'll be stenting my heart to clear up my blocked artery in an hour and a half to 2 hours. That doesn't happen anywhere else in the world. You want to be here. If you have a complex medical issue, you've got an autoimmune issue, chronic fatigue, fibro, post-concussive syndrome, you're in the military, Gulf War syndrome,
Hmm.
um, whatever, then all of a sudden we're horrible because these are things that require complex, multidisciplinary, multiple levels of expertise. And our system is very broken up into silos of specialties. And so it's
Hmm.
great if you've got that niche. If you have a orthopedic issue, you need knee replacement, mean, they're doing knee replacements here in Virginia now. You get a little spinal, they don't do general. It's like amazing now.
Yeah.
But what if you have chronic arthritis? You've got ligament issues. You keep on tearing stuff. You probably have some nutritional issues. You probably might have hypermobility. Let's deal with that. And that's what our system is not that good at.
I was gonna ask about that because like we have some of the best medical in the world, right? Like people from all over the world will come here for like crazy procedures, but then also it feels like we're almost like the sickest country in the world.
Those are two different things that can be true at the same time.
Hmm.
And that's, I think, where you get confused. People are like, well, either we're the best in the world or we're the worst in the world. It's like, well, you can be the best in the world at procedures and high tech and still super crazy sick the people. And that they're not mutually exclusive.
Right.
And I remember this was like 15 years ago. And the University of Miami was one of the first places in the world to do heart valve replacement through your arm. They'd catheterize it, change the valve out.
Wow.
And the head of the healthcare system in Canada at that point in time left their country, flew to Miami because they couldn't do it in Canada to get it here in the United States. Now it's commonplace. Now I can go to my local, Chippenham Medical Center here, which is a big heart center with an HCA and get that done. It's a routine procedure now here. We're really good at that stuff. What we're not good at but at the same time, we have more chemicals in our food system than pretty much any country in the world. There are, glyphosate and Roundup is controversial, right? It's
Yes.
banned in Europe. It's not allowed in Canada yet. We're removing petroleum based. This is you can't make this stuff up. We're removing petroleum based dyes from our food system, and people are up in arms. You can't get that stuff in Europe.
Right.
My wife and I were in Italy, and I was looking at some M&Ms, and I opened the bag up, and the M&Ms weren't as pretty as our M&Ms. They were kind of these ugly colors, and I looked at them. It's like natural beet juice. Beets were for the
Right.
purple. It's like they were using natural stuff for the colors, and they weren't as pretty.
My kids get mad about it because I'll buy the stuff that has like the beets and like the natural colors, and they're like, "These aren't fun." And I'm like, "But they're the same thing. They're so much better for you."
It's just, and so I think we have these two worlds living together where we have all these special interests. You know, the whole low fat thing. Literally, the food pyramid changed a week ago when we're recording this, and it said fats are back, and people in uproar. In my world, I've been using fats to treat brain issues for 20 years. When I see autistic kids, for example, and kids with pandas and pans in my clinic, almost all of them have low cholesterol, too low. It's like less than 140, which is a marker for brain issues. Like, why do we have fat deficiency in our country? Because we demonized it. And so now it's
Mhm.
to the top and people are all in the upper age. And that was not going on in France. When that's not going on in Italy. They don't say low fat over there. It's really bad information for almost 50 years. Chemicals in the environment, high fructose corn syrup and everything, genetically modified foods. And on top of that, you throw vaccines or whatever. And it's like, where 40% of Americans are obese. That's crazy.
Yeah, I was gonna ask about like the obesity because we do see like we're all eating the same foods as we've always eaten, right? Or as we've always eaten is relative, I
Well,
guess. But like
yeah,
Kraft macaroni and cheese when I was a kid is so different than Kraft macaroni and cheese
yeah.
now. Or like bread back then, bread now it's completely different. Like I'll make bread from scratch at home because I don't want to buy it at the store, but it goes bad in like 3 or 4 days because there's no preservatives in it. And so what do people do if they want to start living a healthier lifestyle, but life is expensive?
No, that's you have to you have to start low hanging fruit. What can you change now?
Hmm.
You know, maybe start sourcing things a little better. For example, in my book, I have a whole food sourcing guide for across the country.
Hmm.
So now where you're at, you can kind of find things. So for example, salmon. If you want real wild caught salmon, the best price point is actually Costco.
Yeah.
And you can get a big bag of it bulk. If you want real raw cheese, European cheese, Costco has these big blocks. You get a block for like $15, a huge thing. At Wegmans, that same block is like 80, it's like $15 for the same little thing. If you have kids, they're going to go through a lot of stuff. And so there's ways to do it. But also as a kid, when I was growing up, we had a garden. We grew stuff. My dad hunted, we cut corners and other things. We a lot of our clothes were hand-me-downs or from the local thrift store. So it's like, what do you value? And if you value nice clothes, nice watches, nice car, um, you know, I don't know, then you're going to pay for that stuff. If you don't value your health, you're not going to pay for it. It's really interesting how in our country, but most of the world spends about 30 to 40% of their disposable income, up to 60% in poorer countries on food. The United States, we're like at that 10 to 12% mark. We spend way less on food in our country than most places in the world. And part of that, interesting enough, is the farm bill. There's a big subsidy for grain, for corn, soy, rice. And the result of this is that things that eat that stuff are cheap as well. Cows, chickens, eggs. And so all of a sudden we have a food system where things that are fed genetically modified, pesticide-ridden foods are price suppressed. So all of a sudden, eating the local organic stuff, it's not that it's expensive, it's just that everything else is government sponsored food. And so when you start thinking about it like that, do you want to eat nothing but government subsidized food? It just doesn't sound right, does it? But that's kind of what our current ecosystem has created. So, and I've got resources in my book to kind of help people navigate that. But I feel like just conceptually realizing the reason food is cheap is because it's government subsidized food.
I've been really advocating for my listeners to go and find like local farms. And I know it's really hard when you live in a city, to find like a local farm, but farms aren't that far outside of your city. If you take an hour drive, you might find one. But I actually just did a whole episode on raw milk because I mean, we drink raw milk here. I would love your opinions on raw milk.
Raw milk, oh my gosh, that is illegal. That is illegal in Virginia. I
It's
don't know if
not
I can
illegal
talk
in
about
my
it.
state.
It's illegal in my state. We so when we got my son. he had horrible eczema and asthma. He was 6 months old. And within 6 months, his eczema was gone. A year, his asthma was gone. The first thing my wife did is start making homemade formula for him.
Mm.
And the base for that was raw milk. I know, horrible. We're horrible
How
parents.
dare
You know,
you?
it's bad. You know, raw milk is amazing. It's like if you take raw milk and put it on your countertop, the natural bacteria enzymes will actually naturally ferment it. You know, curds and whey, Little Miss Muffet, sit down Tuffet, eating her curds and whey, right?
Hmm.
That was just milk separating naturally if you set it out for 3 days. And what happens? Whey comes out, the curds turn into stuff, you filter it with cheesecloth, put some salt. That's cork. That's a German cheese. Like milk is this superfood that actually will turn into other things and it
Yeah.
self-digests and it ferments into these amazing things. If you take it and you make water and oil mix, water and oil do not mix naturally. If you take them and make them mix, you change food chemistry. If you ultra pasteurize the milk to 285 degrees, flash heat it, right? You will change the protein structure and actually make the milk casein and other proteins inflammatory, and you destroy those enzymes in there. So the milk story is very much like the bread story. Like raw milk and ultra pasteurized, homogenized milk with recombinant brown growth hormone and about 50 um, milligram equivalents of antibiotics in it. It's not the same as the raw milk from my farmer 20 minutes down the road.
Right.
And it's really interesting. There's a thing called C15. I don't know if you heard C15. Does that sound familiar to you at all? C15.
No.
Okay.
Mm-mm.
You'll like this. Your listeners will love this if they like rabbit holes and conspiracy theories. So about a third of the country is deficient in C15.
Okay.
Okay. And C15 deficiency in dolphins is associated with dolphin dementia.
Oh, wow.
It was actually discovered by vets, dolphin vets, and they realized when they fed dolphins back a diet, the regular diet, the dolphins wouldn't get dementia. And significant Americans have this deficiency in this saturated fat. The source of it from it in our diet is actually um, fermenting animals' milk. So the cream, basically. So all of a sudden, all of your raw milk, your cheese, and all similar products, butter, ghee. Well, what have we removed from our diet for the last 50 years? Fat. So we actually induced this essential saturated fat deficiency in our population from this and from our recommendations. And where would we have gotten that historically? Milk, butter. So milk is
Fats.
interesting. Yeah, it's interesting. It's interesting. So I mean, some people can't digest it. Yes, some people have lactose deficiency. Yes, certain ethnicities don't digest it. And yes, as you get older, you tend to not digest it quite as well. These are all true. These are all true, and true.
Hmm.
But it doesn't mean fermented foods aren't still ridiculously healthy for you. And it doesn't mean that things like butter and ghee aren't still ridiculously healthy for you. So we finally have removed we've been demonizing fat for all these years. And now the government has finally recognized, hey, we have a fat deficiency syndrome in our country, a nutrient deficiency syndrome, and we need to fix that.
That's interesting because yeah, I did this episode and I was like, my son had eczema. He had chronic diaper rash, and
Mm.
like his whole first year, and we lived in Colorado at the time. We were looking for raw milk, but we just couldn't find it.
Yeah.
We were on a wait list for like 2 years because everybody wanted it. And so when we got here, we switched into raw milk, and he has not had a diaper rash since. Like cleared him up, and I was like, "There's no coincidence here that raw milk
It's
cleared him up."
it's raw milk and ultra pasteurized milk are not the same species. They might both be white, but it's not the same thing. Just like bread, my bread, your bread as well. It's the einkorn or whatever grain you use, salt, water, and then the culture. The bread that has bread emulsifiers in it, that has bread conditioners in it, that's been chemically fermented for 3 hours, not traditionally fermented for 24 to 40 hours, that doesn't use a polyculture, that uses a Saccharomyces cerevisiae culture that was invented in the late 1800s called Brewer's yeast. There's so many things that go into that make bread what it is today. It's not what it was 2, 3, 4,000 years ago. And so when you say bread good, bad, you're talking about two different species of things.
Yeah, I could see that. So you talked about environmental factors a little bit ago, and I kind of jumped over it, but I want to go back because um the people that are gardening, that are bringing their food out of the garden. Like they have all these, like even if they have like cows or pigs or whatever, and they're eating the grass like they should be. What do we do about chemtrails and how that is affecting our food?
You want to do the best you can do. So, in this world, you're not going to be perfect. We literally have information from polar bears in the North Pole having pesticides in their fat. Where do they get this stuff? It's from
Right.
stuff getting in the water and then it gets in the fish and then they eat the fish, right?
Hmm.
So there's really no place you can go where it's going to be pristine. So it's about minimizing exposure. And the human body is amazing. I mean, I'm amazed that any of us are alive when you start studying it and you learn that the 80,000 plus uh, chemicals that are produced in our country. We've studied maybe 2,000 of them to date for safety. So the vast majority of them, we have no idea if they're safe or not, right? And so it's just about minimizing exposure. And part of the way your body was amazingly made was if you get the right nutrition, if you get the right antioxidants, you can actually use vitamin C, for example, as a protectant against pesticides. There's this interesting case in the book I was reading recently about, it was about four kids, those two older kids, and I'm sorry, there's two older kids and a younger kid. And they were out in like in Kentucky or somewhere, and a plane came over top, and they weren't supposed to be there and got hit with they were dusted with, I forget what the chemical was. It was some pesticide. And the two older kids covered the younger kid,
Hmm.
went to the hospital. Um, the younger kid got IV vitamin C. One of the older kids got IV vitamin C. The other kid didn't. The younger kid was fine. The other adult guy, boy was like, he was okay. The one that didn't get IV vitamin C died a couple days later. Like the
Oh.
IV vitamin C was able to block the oxidative stress, the inflammation, the toxicity effects from the pesticide. And you can, just from having adequate vitamin C in our diets, you can actually help ameliorate some of the negative impacts from lead, mercury, arsenic, all these kind of things. So just having appropriate nutrients in your diet, minimizing exposures can actually have a big impact for all these things. And that's kind of, my dad wasn't living on a farm growing up as a kid.
Hmm.
They used arsenic in the chicken feed. He actually used DDT in his house as a spray to kill bugs.
Yeah.
He's turning 88 this year, but he ate deer they caught, they went hunting, they had their own stuff they raised. Like the only stuff he ate as a kid growing up was stuff they caught, grew, or killed themselves. And so it's a different world where he was eating real food and literally had DDT spray in his house and used arsenic for chickens. And he was 88 and still trucking along.
What do you think about like worms and like people like doing these parasite cleanses and stuff that don't seem to be acceptable? Right? Like
You know,
animals get parasites. How come we are told we're not getting parasites?
Oh, no, we do have parasites. A third of the world's population has a parasite of some sort. In Virginia, in southwestern Virginia, parasites are endemic. And if you talk to veterinarians, they're like, if you have a pet in your house, if you have a dog or cat in your house, you have or chronic parasite exposure.
Hmm.
The bigger question is, all parasites bad? You
Mm,
know,
that's a good question.
um, there are there's some literature suggests that the parasites actually help educate your immune system to lower your risk for allergies, for
Oh,
example. So if you look at sub-Saharan countries that are endemic with parasites, okay, you don't see inflammatory bowel disease, you don't see Crohn's, you don't see autoimmunity. There was this interesting population experiment with the iron, not the iron, the Berlin Wall when it got pulled down. You had some parts of Scandinavia. One part was Russian, one part was Western. And so the Eastern Europe or Eastern Germany or the Russian part, they were still very um, living like almost like 40 years earlier. Everybody had
yeah.
parasites, dirt everywhere, low asthma, low eczema, low
Hmm.
autoimmunity. The cleaner areas, they were having lots of issues. So the question is, are parasites, like a lot of things in the environment, are they tonics for our immune system? There's some literature suggests that. Um, but if you have a chronic leaky gut and you have toxins in the environment, might you lose tolerance to those parasites and might they cause issues? Yes, and we're seeing a lot of this toxin-induced loss of tolerance called tilt syndrome, where chemicals in the environment make us more prone to allergies, eczema, asthma. It's really interesting if you look at hay fever became endemic in Europe with the Industrial Revolution. It wasn't
Hmm.
until you saw lots of coal burning, lots of smog in Europe that populations started getting hay fever. It used to be hay fever used to be farmers got hay fever, right? And so So parasites is not a yes no thing, and I've done some of my work with patients. Had patients, some autistic kids that actually ordered special pinworm based parasites from Duke
Okay.
that we used to help treat some of their autoimmune issues. And so
Yeah.
it's not a parasites all bad, parasites all good. Um, but another part of that, another rabbit trail is when you go to third world countries, people will have because of malnutrition, they will have parasite overgrowth.
Mm.
And with malnutrition, they'll have issues. And I've actually had a kid actually in a mission hospital in Honduras die from that. He was actually coughing up parasites. But if you
Oh my
talk with your
gosh.
farmers about cows, they're like, all the cows have parasites. It's just all we do is control the number, and and so it's more complicated than everybody needs a parasite cleanse. But for some people, and I check for parasites routinely. It's a standard part of the thing I do. For some people, it's a big part of what they need to do for their health. But like many nuanced things, it's not all bad, all good. The devil's in the details.
Right. But like, oh, so if this is a detailed question. If somebody does a parasite cleanse, but they have animals living in their house, right? So they're likely, I mean, from what you're saying, they're
Hmm.
gonna get parasites back. Is
Yeah.
it fine to do the parasite cleanse because then you'll get those parasites again and they'll
Okay.
be like
So
doing what they should
so
do in
what
the gut?
well, what is a parasite cleanse? And typically it's things like clove, artemisia, black walnut extract. It's usually these herbal things that also are anti-inflammatories.
Mm-hmm.
They also control yeast, strep, staph overgrowth in your gut. They also have these things called polyphenols, which are chemicals that feed certain bacteria. They also tend to help improve liver detoxification and bile production. So the question is the parasite cleanse just a parasite cleanse? And
Okay,
the
yeah.
answer is no, it's not just a parasite cleanse. It's also resetting your gut microbiome. It's also anti-inflammatory. It's also helping your liver detoxify. So what is, you know, what's the big therapeutic result? Is it the parasite cleanse or all the other stuff it's doing? I think for that'd be a great conversation to debate. But it's doing more than just the parasite cleanse. Because when I give people prescription medications for amoebic dysentery or Entamoeba histolytica or whatever other, pinworm, whatever, it's very specific for that. It's not doing this other. When I give people oral prescription antiparasitics, they're not having the same anti-inflammatory detox response with um, a naturopathic or a traditional Ayurvedic parasite cleanse. So we're not even talking about the same thing when I talk about medical
Right.
versus a herbal parasite cleanse.
That makes sense. I want to know why so many doctors, and so we're having this debate right now in the world, I think, or from my perspective, because I live in this like bubble, I think, of conspiracy theories, where we have like the functional health, which is getting very popular. We have traditional health, which is paid for by insurance. So why are so many doctors that are traditional, right? Like, or traditional for us, like Western medicine, that they just look at the symptom, they throw medication at it. Why are they not looking at the whole person the way functional health does?
I mean, the reason there's conspiracy theories is there's a grain of truth to them.
Mm-hmm.
The question is, once you go in the rabbit hole, where you come out, is that truth or is that totally off base? And that's where I
Right.
think having conversations is great. And everything's kind of complicated when you kind of get to it. But the, the ultimate answers should be basic and simple for us to apply to it. So I think the simple answer here is you get what you pay for.
Mm.
And so when you come see in my old practice, I would see 6 people an hour. So that's like every 10 minutes I'm seeing someone. You come check in the front desk. Insurance says I have to screen you for depression. I have to screen you for your vaccines if you had them. I have to verify who you are. Even if you come into my practice for 20 years, I have to look at your ID and verify that grandma is grandma. She hasn't changed. That takes up 15, 20 minutes. You finally get back to see me after doing all the things we're mandated to do. I've got 5, 7 minutes with you. And you come and talk to me about all your headaches and your rashes. And I'm like, oh, here's a migraine medication. Here's some topical steroids. How your kid's doing? We'll see you later. That's your 5 minutes, right?
Right.
You get what you pay for. If you go to a functional minded, when I do my intake, it's like a 2.5 hour process. Reviewing your history. I'm spending probably an hour reviewing the labs. Totally different experience. We're looking at totally different things. And that's where I think the difficulty is with our current system. It pays for procedures, it pays for volume. It doesn't pay. cognitively, it doesn't pay for your doctor to sit and think, to
Mm.
process and say, what, why are you having these rashes? Why is your son having this butt rash? What's his fatty acid level? What's his vitamin D status? Has he had a gut stool analysis? Like that is going to take me extra time. And I remember when at my old practice, when I'd order labs on people, it's like, okay, I've got literally at the end of the day, I'm gonna review labs for 30 or 40 people. I have 30 to 45 seconds per person if I want to go home and see my family.
Right.
So I can't, so I wouldn't order a lot of fancy tests. Refer to endocrinologists, refer to cardiologists, refer to specialists, because there's not time in the system. And so I think we're getting part of this is that you get what the system's designed for and you get what you pay for. When people are wanting to pay government rates on government and approved insurance for personalized individualized care. It just doesn't make sense. You have government approved insurance through corporations, lowest common denominator, rates go down every year, but yet you want this high level individualized personalized care. It's like it's not going to work like that.
Hmm. Yeah, I just think the system's broken,
I mean,
unfortunately.
that's a short answer.
Yeah, because
Well,
like,
I mean, well, the thing is the system broken or is it working as designed? It's very much similar to the system. My grandfather, you get a bronchitis, you go to the doctor, they check you in, they listen to your lungs. This is your acute issue. Here's your antibiotic, and you go home. And that, how's that different than what happens today? Minus the things I mentioned. It's about the same. Where system is working the same. This AI world, where literally you can have access to the mass of the world's information, our healthcare system is still working the same way as it was half a century ago. And you have people like me starting practices. We're trying to do things differently with AI infused practices using, functional medicine labs. I've got 3 board certifications, so I'm looking at a bunch of different databases. I'm in multiple groups around the world with different doctors doing really cool stuff. If you want access to that, that's not going to be a 5-minute visit.
right. Yeah, I go to a functional medicine clinic here because I just got sick of being sick. Like, because like you'll go to the
Yeah.
doctor and you're like, I don't feel good. And they're like, well, take this medication. You're like, well, the medication made me feel worse. And they're like, well, just give it a few like months to kick in. Then when it does kick in, now you have all these weird side effects. They're like, well, take this medication, take that medication. Finally, I'm like, okay, here's the deal. Like, I'm having more side effects than what was wrong with me to begin with. I don't even want to take all these things. I'll just deal with the issue.
If you want to, go down a little rabbit hole, 30% of all drugs are mitochondrial toxicants.
Hmm.
So basically means 30% of drugs can actually mess you up if you don't watch the side effects. That's the first thing. The second thing is, according to the current literature, it's possible that medical error is the third most common cause of death in our country.
Wow.
So all of a sudden, it's like we have this system that's volume in versus out, that's not contemplative, that doesn't look at the whole person. And we have problems. We're going to have medical error. We're going to have issues. So I think you have to educate. What I'm trying to do is educate people from the bottom up. And I'm not waiting for the government to make decisions. I'm not waiting, 23 years for the government to say hormone replacement therapy is okay, which they did
Right.
November, or to say fat's back, which it took half a century to happen last week. You have to make your own path. And ultimately, you vote with your money. And if people are demanding better health care and they're voting that way with their votes and with their money, the system will change slowly, but it will change. And that's what I feel like we're starting to see now. People voted differently, whether you like it or not, a year ago, and we're seeing those changes. And many of
Yeah.
them, like fats are back, petroleum-based dyes are out of the food. We're questioning fluoride in the drinking water. Like I think these are good things for health.
Yeah. I remember what my question was.
Okay.
Well, it's more like a statement. I would like you to talk about the gut microbiome because
Mm.
it's the second brain, right? And we have this depression and anxiety epidemic in our country. And I'm wondering if it's because we're so malnutritious. Wow, malnourished. Wow, that was
So
hard.
you've got the gut. You got the lining, the wall of your gut, which is where 80% of your immune system is. And you've got this ecosystem that creates 75% of all neurotransmitters, 90% of serotonin, 50% of dopamine in your gut. Then you have the bacteria. You have this metabolic engine of these bacteria that produce vitamin K, that produce B vitamins, that produce butyrate, short chain fatty acids.
Hmm.
And we're just now learning how important it is. If you have an autoimmune disease, for example, by definition, you have to have four things. One's leaky gut, and one's a chronic infection. And for many people, that chronic infection is abnormal growth of bacteria in your GI tract.
Hmm.
Genetically speaking, humans have like maybe 23,000 genes plus or minus. There's a million genes in the bacteria that are in and on your body, 99% of which are in your GI tract. So all of a sudden, your gut becomes this place where you develop tolerance to the environment. Everything you breathe and eat, your immune system in your gut with the bacteria says, ignore, 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 ignore. And you want them to ignore it.
Yeah.
99.9% of what your immune system is supposed to do is ignore dust mites, ignore dust, ignore pollen, ignore my thyroid, ignore my joints, right? But when it becomes dysfunctional, that's when you get inflammation and a bunch of other things. So the gut microbiome is a metabolic engine, produces nutrients we need for our body, but it's exquisitely here. Well, here, let's go down the beaten path here. Roundup, glyphosate, God's patent as a blocker for the shikimate pathway.
Hmm.
It's fine for humans to take because we don't have that enzyme, that pathway in our body, but bacteria do.
Oh,
So,
there it
you
is.
connected, you can there, that's the dot you just connected there. It actually will affect the bacteria in your gut.
Which you
And wait a second,
need
which
to
you need,
have a good.
but that's not all. That's not all. um, over 90% of Roundup is actually a petroleum distillate.
Hmm.
Petroleum distillates, when I got grease on my hand when I was a kid, I didn't know any better. I would use a petroleum distillate, kerosene to clean off, or spirits to clean off the paint from my hand.
Yeah.
That's in something like that's in Roundup. So now you have these distillates that you're getting in your body that dissolve the mucus in your gut.
Mm.
All of a sudden now there's a biological plausibility for why one chemical, Roundup, could have multiple different negative impacts on your health, irrespective of whether they're directly affecting you because of the bacteria in your gut.
Hmm. And that's just like you said, one example. Like how
One.
many examples out there, like, and people don't even know about it. Oh my gosh. This is so good. I'm
Um,
loving this conversation. And then I also wanted to bring up the maternal mortality rate in our country
okay.
because I feel like we have, like we discussed, we have a fantastic healthcare system, except we're killing mothers at a crazy rate.
See, I'm not up to date with that number. What's the current number right now in our country?
Let me pull it up.
Because when you might have to educate me here, because my brain is going to 15 places right now with that, whether having
So,
babies, let's go ahead.
um, maternal deaths, they decreased in 2013 from 18 or 2023, excuse me, 18.6 per 100,000 live births and to from 22.3. So it went from 22 to 18 in 2023. But 18 out of every 100,000 mothers are dying.
Yeah. That's not as bad as it used to be.
You're right. That's good.
A quarter of women used to die. Um, Having babies is risky business. And
Yes.
it was routinely you'd see a grave size, a husband and two wives at a grave, and it's like the husbands would bury the wives, and you see some small little baby graves. They bury babies as well. Part of the whole issue with life expectancy has been skewed historically because you take a bunch of zeros, ones, and twos, and a bunch of 20s and 18s from the moms. All of a sudden, it makes life expectancy look like we're dying super young.
Hmm.
I have this paper I've got on my desktop that was looking at the life expectancy in the United Kingdom in the 1700s in males past adolescence. So it was ignoring kids and babies, it was ignoring women. It was
Right,
just
because they were dying really fast.
yeah.
Or-
But in 1700s in the United Kingdom, life expectancy was 72 to 73 in a male if you made it to adolescence. Well, now it's like 82, 83. So literally antibiotics and surgery added maybe 10 years.
yeah.
That's not super impressive if you think about it.
Hmm.
Well, where we get these numbers of like, the average age was 30 in the first century? It's because so many people died in childbirth, and so many babies died before the age of 12. I think the bigger story here, and this might be what you're referring to, is why we do so many C-sections in our country. Why is it some states like half of the deliveries are about be C-section, and you go to Ireland, it's like 5%.
I do want to get into
That's
that,
a,
but I want to go back to this question. I'm not trying to veer you
yeah.
off the, but so this question was specifically compared to other countries. So like the United
Oh,
States, we're
okay.
having 18 per 100,000, whereas like Norway has zero. Switzerland has
Okay.
1.2. Australia has less than five. Japan has less than five. The UK has five and
Okay.
a half. Canada has eight. So we have at
Yeah.
least 10 more compared to Canada.
Yes.
I do want to
So
get into C-sections though.
well, like, what's a big driver for that? You have to look at nutrition. Women's pelvises are getting smaller. Like,
Interesting.
our facial features are changing. Actually, Weston A. Price, if you ever heard of Weston A. Price,
Hmm.
he was actually a dentist, went around the world in the 40s and 50s. He found that nutrition would change facial features, uh, change
Mm,
risk for certain diseases. But one of the things it does is your facial features will change and pelvis sizes will change over generations of malnutrition.
yeah.
And so the question becomes, okay, this is where the devil's in the details. Okay, so which is it babies that aren't making it out? Is it babies that are having their head crushed by forceps? Is it moms that are needing C-sections? Because each of those have potential of a different cause, right?
Yeah.
If you're a mom who has a small lower jaw, who's malnourished, you're gonna have a smaller pelvis, and all of a sudden it's hard to put a baby through that.
Mm,
You have to get C-section. And their healthcare system itself is like, hey, I got golf game going on here, whatnot, it's kind of long. Let's go on and schedule your C-section, right?
right.
Versus other places are like, they're not doing that in Ireland. They're not doing that in these other countries. And then there's the whole thing with the infant mortality issues, which goes into infections and things like that. So I think when you look at a number like that, I'm like, okay, the questions I'm going to ask are, is it okay? Is it the maternal morbidity? Is it directly related to C-sections? Is it directly related to the delivery process itself? There's so many things, that I just mentioned that we have kind of sort of wrong that could be adding to that. It's not
Mhm.
going to be as simple, our spinal epidurals are worse than they are in Canada or whatever. I think it's going to be more nuanced, if that makes sense.
Yeah. Talk about babies that like vaginal birth babies versus C-section babies because there is a difference in their gut microbiomes and like how they develop over time, right?
So nature is infinitely complex. It is so cool. You can't make this stuff up. So the last trimester of a pregnancy, a mother will switch, your body switches the kind of bacteria in your vagina to Prevotella, to more Prevotella dominant. What happens when the baby's born, the first swallow is actually a gulp of vaginal fluid. And whatever's in the vagina, strep, staph, yeast, or Prevotella or Bifidobacter, whatever's there, will actually be
Hmm.
the first thing that actually starts um, populating the baby's GI tract. And then the baby gets coated in the vaginal fluid and the baby's like there. So what do we do in our country? You C-section, you bypass that. Baby comes out, you wash the baby down, scrub them down with
Yeah.
soap and water. You know, Now we're getting smarter and we're actually, okay, we're not going to bathe the baby for a day, right? We're going to let the bacteria sit there. If the baby's a C-section, we're going to take a sponge from the mom's. The really high level birthing centers are doing this here in the United States now. They'll take a swab of cotton 4x4s, swab your vaginal area, and then stick the baby's nose and rub the baby down with it to try to populate the baby with mom's bacteria. Because if you don't, what happens? The baby gets populated with the skin bacteria from the surgeon,
Mm,
which is totally different. And that, C-section babies are more prone for asthma, eczema, autoimmune issues, and then breastfeeding. The first 7 days, the colostrum. Every baby's born with leaky gut.
I didn't know that.
Okay. Yeah, they're all born with leaky gut. And the colostrum has lots of IgG immunoglobulins that actually seal that gut up in the first week. Well, if you C-section and go bottle feeding, guess what happens? You don't get the right bacteria, and this leaky gut takes longer to heal up. And if you're using really bad formula, maybe it doesn't ever quite heal up. So the natural process is so complicated and so beautiful and so like cool. But also, if you deviate from that, it can really result in a lot of issues.
So if a mother's having a baby that's not at one of the like they had a C-section, but they're not at one of the hospitals that would swab like
Yeah.
and put it all over the baby, can a mother do that? And like how is it still helpful like 3 hours later, 4 hours later, like 6 hours later, whenever like they're back in their like mom baby unit, right? And they're just with their baby and they're like, hey, husband, like help me out here. Like I know that sounds
Yeah.
weird and gross, but like
It,
would that
it's
still
it,
help?
it it is weird and gross, but the natural way is the baby's slimy for a day and you bathe it a day or two later. So nothing's weirder and grosser than that. Nothing's weirder and grosser than what's supposed to happen.
Right.
Right. So, that's, I'll see kids with eczema, asthma, IBS, allergy issues when they're two-ish. And, it's interesting how you can still work on them. Usually they have fatty acid deficiencies. When I do their gut testing, usually it's a wreck, so we fix their gut. Um, Usually they have other, the vitamin D levels are almost always low. So I've had really good success with helping these kids later on. So it's not hopeless. There is hope. You can do things about it. I just want moms out there, don't beat yourself up. You don't know what you don't know.
Right.
And the fact that you're listening to this and hear this and you want to make a difference, you can 100% change the trajectory of your child. I wouldn't focus on I should have done, I should have done, I should have done, because I feel like that's where people get stuck. There's so many things you can do. And I think about my kids when I got them, the situations they went through, and they're all thriving now. And they all came from pretty crazy situations. So it's still possible. I don't know if I mentioned, I forget what I say when I say how I say it, but my daughter's situation, my other daughter's situation, my son's situation, they all came from pretty crazy places and they're all thriving right now. So
You adopted all three
it's
of them?
adopted all three. Yeah.
Okay. You brought up vitamin D deficiency a couple times, and so I wanted to know if you would get into that a little bit because we see it in children, we see it in adults. What do we do about vitamin D besides like just taking a supplement, which is an option?
You know, Food sources for vitamin D are cod liver oil, organ meat, and liver. So that's where you get it from mainly in your diet. So eat those things. So are you going to do that? Are most people going to do that? The
Probably
caveat to
not.
that is a 30% of meat consumption in the United States before 1950 was organ meat. So we actually used to eat this stuff. We can eat it again. We can eat it again. But as far as getting it from the sun, people will say, I'm just going to get it from the sun. The problem with that theory is that in order to make enough vitamin D on your skin when the sun hits it, you need to have sebum, a layer of fat on your skin. And part of the way your body makes vitamin D is UV radiation hits, UV B particularly, hits your skin, hits this fat molecule, breaks down, da 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 da, but you start forming it in your skin.
Hmm.
If you wash off the natural fats from your skin, you won't make as much vitamin D. So, who takes a shower every day with soap and water?
Most
The answer
people.
is most people. So, you're automatically going to diminish your body's ability to make vitamin D in your skin. And so all of a sudden, like, well, how do you fix that? Well, don't shower and run around outside with your clothes off or take a supplement. There's so many patients I've seen, white skin, fair skin, black skin, brown skin, whatever, and vitamin D deficiencies are everywhere. But there's one person I've seen with skin of color who had normal vitamin D levels, and I know him because he was my son, and he would not take a single supplement. Also, wouldn't shower and ran around outside all the time as a kid. And his D levels were amazing. And I was like,
Boys.
I know. Here's the stage of life when showers were like, a once a week, maybe kind of thing. And his room, and he smelled like it. He's grown out of that stage in life now, fortunately. He's 15 and grown out of stage in life. But it's amazing. Like, so the question becomes, okay, are you going to go,
We should work
go
out
primal?
outside.
Well, but then you put suntan lotion on, you put clothing on, you block the sun, you block UV B that burns and makes it. So now you're just getting the A exposure. So all of a sudden you're still not going to make the same amount of vitamin D. So really, in today's modern culture, unless you eat organ meat, cod liver oil, or don't bathe regularly, you probably need to supplement.
Interesting. I didn't know that.
Yeah.
Um,
The
what do you think
caveat
about?
to that
Oh, sorry. Go ahead.
I'm sorry, make sure the D has at least K2, MK7 in it, because for D to do what it needs to come with the other fat soluble vitamins. So that's just a little caveat. When I have people supplement D, I don't just do D, it's D with the other fat soluble vitamins.
So, what do you think about sunscreen then?
I have a love-hate relationship with sunscreen. I'm 52 and I put it on because I don't want to burn, because I don't want all that kind of stuff. Um, but a lot of skin creams, sunscreens are toxic. Look at the chemicals in them. You're putting different phthalates, if it feels nice and soft and smoky, it probably has these things called phthalates, which are neuroendocrine disruptors. I tend to use just a metal-based zinc titanium type ones, but the best thing is just covering your skin. So what I do these days is just I go outside with my long sleeved, and it's actually kind of popular now wearing those photo protective
Yeah.
clothing with a hat. That's actually probably the way to go, and just putting sunscreen basically then on your face, because sunscreens themselves, the really good ones are expensive. Um, you got to put them over all of your body. And do you apply an ounce, every hour to your body when you're outside? The answer is most people don't. So, so it's the smart thing is to use clothing. And aside to that, I did a lot of dermatology training at USF back in the day. And it's interesting if you look at these melanoma maps with melanoma incidents, and it exploded in the 70s, late 70s, early 80s when we started using more sunscreens. So there's a question on, do sunscreens prevent, they actually might, using them might actually increase melanoma risk because you make less vitamin D and you get more UVA radiation exposure. So
I
that's
was
a little
wondering
nuance.
also if it's like because your skin is not used to seeing the sun because we're wearing sunscreen, like then when it does see the sun, like does your skin start to have like a almost like an adverse reaction?
Well, that 100%, that's the reason why people have a lot of issues in the spring because they've been clothed, and they all of a sudden go out for 4 hours and they burn like crazy,
Yep.
or get these autoimmune, you can get these actually photosensitivity reactions where skin, the vessels, it's actually a type of vasculitis where vessels break and stuff because your skin's not used to it. So historically, we'd be outside in the sun all the time, right? There was
Yeah.
no staying indoors thing. So we do have some things that are induced. So in the spring, myself and my kids will like go out for an hour. We slowly introduce ourselves back to the sun so we don't burn. But the biggest concern with your skin is actually blistering burns. That's when you really ramp up your risk for melanoma or other skin cancer. So graded exposure is helpful, and covering is probably best.
So getting a little bit red is okay as long as it's not blistering.
Correct. Yeah, that's actually called a minimal erythema dose. And if you get a full body of that, um, you make about 20,000 units of vitamin D. So it's a
I try to do
marker of,
that with my sons. I'm like, okay, we're gonna go outside. As soon as they start to look red, I'm like, okay, now we can go inside. We can
just a little
cover
bit.
up, or
Yeah.
we put on some sunscreen. Like, I
Yeah.
I don't completely take out the sunscreen, but I'm very like cautious about
Yeah.
like just I don't slather them in sunscreen either
Yeah.
because I don't know. I go back and
Yeah.
forth.
So what I do is what I do is I take my shirt off and get my 20 minutes like you did, and I put my shirt on and my hat on. So I get my exposure like my 20
Right.
minutes. I'm pale complected. My son says pasty. He has beautiful browns. He has beautiful brown skin. He turns this beautiful chocolate color. And gets these beautiful highlights. I'm super jealous, but
But then he
he doesn't
makes
have
fun
to
of
worry
you.
about it. Yeah, he doesn't have to worry about it. He just turns chocolate and his hair gets light and he's looks super cool in the summertime.
Dr. Aaron, what is the name of your book?
It's uncurable, from hopeless diagnosis to defying all odds.
And I will link that in the show notes. Do you have a website you want me to link as well?
Yeah, uncurablebook.com and then aaronhartmanmd.com.
Perfect. Thank you so much. I feel like we learned a lot today. I asked you some crazy questions, so
We went all over the place. Yeah.
I figure since I have you, I should ask as many questions as I could come up with, and I tried. So,
This is your show. This is your thing. I'm here. I'm along for the ride.
well, I appreciate it. Until next week, my friends, stay skeptical, and we will see you all then. Hey friends, The Rabbit Hole is an independent podcast written, hosted, and produced by me, Danny Mercy. Special thanks to Lindsay for research and writing. If you love the podcast, please leave us a 5-star rating and review wherever you're listening. Follow us on social media at rabbit.holepodcast and visit our website at stayskeptical.com for everything else.